Arthritis is an infection that can affect the knees, the joints of the palm of the hand, or a section of the spine. The two most common types of arthritis are osteoarthritis and rheumatoid arthritis. Pain and stiffness in the joints, these are the main symptoms of arthritis. Less common types of arthritis may be the result of other medical problems affecting other parts of the body, such as lupus disease, which may affect the kidneys, lungs and joints, psoriasis, which is mainly a skin disease, sometimes affecting the joints as well. Arthritis symptoms. Symptoms of arthritis. The most common symptoms of arthritis depend on the type of inflammation and may include ache, stiffness, swelling, redness, a decrease in range of motion. Some specific types of arthritis have symptoms and signs that affect other organs in the body. These symptoms include high body temperature, tired, rash, weight loss, breathing problems, dry eyes and mouth. Causes and risk factors of arthritis. Causes of arthritis. With age, the risk of developing many types of arthritis increases. The pain associated with arthritis arises as a result of a joint injury. The joint consists of the following parts: articular cartilage, arthrodial cartilage, articular cartilage, a hard, but smooth, covering at the ends of the bones. The meniscus enables the bones to move smoothly, easily, one on top of the other. Articular capsule, a tough membrane that envelops all parts of a joint. The synovial membrane, a thin membrane that surrounds the joint capsule and produces synovial fluid, which is used as a lubricant for joint movement. How does arthritis affect the joints? The two most common types of arthritis affect the joints differently. Osteoarthritis, damage and tearing of the cartilage may create a position in which one bone moves on the back of the other, causing them to erode together, causing pain and limiting the range of movement of the joint. The process of damage and tearing of the cartilage can last for many years, and can occur quickly as a result of injury or infection in the joint. Rheumatoid arthritis. Rheumatoid arthritis, in this type of arthritis, attacks the membrane microalbuminuria, the immune system, and causes the inflammation which leads to swelling, redness and pain in the joint. Ultimately, this disease may damage the cartilage and bone attached to the joint. Risk factors for arthritis include family history. Some types of arthritis are hereditary, so the risk of developing these types is higher in people with a family history of the disease, that is, those who have parents, mothers, siblings or sisters who have had the disease before. It is not genes that cause the disease, but they raise the degree of sensitivity to environmental factors that cause the disease. Age. With age, the risk of developing many types of arthritis increases, including osteoarthritis and rheumatoid arthritis. Gender. Women are more likely than men to develop rheumatoid arthritis, while the majority of people with gout are men. Previous joint injuries. People who have sustained an injury to the joint during, for example, a sporting activity, are at risk of developing arthritis in the same joint that was previously injured. Obesity. Carrying extra weight puts pressure on the joints, especially the knees, pelvis and spine. People who are obese have a high risk of developing arthritis. Arthritis complications. Severe arthritis, especially when it affects the hands or arms, can make it difficult for the patient to do simple daily tasks. Arthritis in joints that carry weight may make it difficult for the person to walk or sit upright. In certain cases, joints may be curved and deformed. Arthritis diagnosis. Depending on the type of arthritis they suspect, doctors recommend some of the tests detailed below. Laboratory tests, analysis and examination of various fluids in the body can help determine the type of inflammation. The fluids that are examined and analyzed are the blood-urine joint fluid. To obtain a sample of joint fluid, the doctor must sterilize and numb the skin, then insert a needle into the joint cavity, to withdraw a little of the liquid inside it. Take photo. The following tests can indicate problems in the joint that are causing symptoms of arthritis, including X-ray image magnetic resonance imaging MRI arthroscopy. In certain cases, the doctor searches for an injury to the joint by inserting a small, flexible tube called an arthroscope through an opening next to the joint. The endoscope broadcasts images of the joint cavity to a video screen. Arthritis treatment joint stabilization with a cast can be effective in treating different types of arthritis. Arthritis treatment is focused on relieving symptoms and improving the ability of the joints to function. Sometimes, there is a need to try different treatments, or to combine different treatments with each other, in order to be able to determine the best treatment for a specific patient. There are many medications for treating arthritis, depending on the type of inflammation. Common medications for treating arthritis include pain medication. This type of medication helps relieve pain, but does not affect inflammation. Anti-stimulant drugs. Non-steroidal anti-inflammatory drug, NSAID, anti-rheumatic drugs to change the nature of the disease-modifying anti-rheumatic drug, DMARD. Biologic drugs. These drugs are usually used in combination with DMARD drugs. Bioreactor modulators are genetically engineered materials designed to suppress the immune system. Corticosteroid treatment. Physiotherapy. It can be effective in treating different types of arthritis. Exercise can increase the range of motion and strengthen the muscles around the joint. Fixation of the joint with a splint may be useful in certain situations. Surgery. If conventional treatment methods do not help and do not achieve the desired results, the doctor may recommend a surgical procedure such as synovectomy, synovial membrane, joint replacement. Detailed integration. Prevention of arthritis. There is no known and clear way to prevent arthritis, but maintaining a healthy weight and practicing physical exercise regularly will reduce the risk of infection.